The CDC has just concluded its national conference on the spread of the Zika virus. We have confirmed that the disease has reached the United States in a few isolated cases. While the virus has been seen in the United States before, the first reported case of the virus that is believed to be a result of the current outbreak in South America occurred in Hawaii in February of 2016, when a child was born with deformities as a result of his mother being infected with the Zika virus during a trip to Brazil. That following April, an individual in Florida was killed by the disease. As further research has been conducted on the disease, we have confirmed that Zika is spread by Aegypti and albopictus mosquitoes, which thrive in hot, tropical climates. These mosquitoes are prevalent in Central and South America, but we do have reason to believe that they could thrive in the southern United States, with Florida's Everglades region as a key zone of concern. The majority of individuals affected with the Zika virus will show mild symptoms of fever and rash within a week of infection, but very few individuals will show life-threatening symptoms. The greatest concern of the Zika virus is the transmission of the virus to children born to infected mothers. The disease causes newborns to be born with extreme physical deformities that threaten the life of the child. Although very few cases of Zika have been reported in the United States up to this point, taking personal precautions is the best way to avoid contracting the disease. We recommend that individuals, particularly those that are pregnant or are likely to become pregnant, avoid traveling to Central or South America. In addition, extra precautions when engaging in sexual behavior are recommended as well. We believe that the Zika virus can be kept in check in the United States as long as each individual takes the precautions that we will outline in the following press release. It is of utmost importance that each individual be aware of the potential dangers of the Zika virus. Understanding, awareness, and precaution are the best tactics for the prevention of the disease, but this is a community effort. Action now can prevent infection later. Our goal is to further prevent the spread of the Zika virus without infringing on the day-to-day lives of our citizens. We value both your health and your freedom. Please contact the CDC at 1-800-232-4636 with any questions pertaining to the Zika virus. Medical professionals will be on the line at all hours to answer questions and concerns about the virus. Do not hesitate to call. The CDC is here to help you. In the following press release, we will detail specific strategies that we plan to enact to aid you in the prevention of Zika. Please stay tuned.
Zika is beginning to spread around the United States. This is due to people traveling to areas where the Zika virus is more prevalent and a lack of knowledge about the disease. Zika can not only be transmitted from mosquito to person, but also person to person through sexual contact and blood transfusions. In addition, pregnant mothers can also transfer the virus to their fetuses. To help eliminate this problem, we, as a society, should attempt to postpone visits to southern tropical areas in and outside of the United States. If you are traveling, be conscientious of the area and do simple things to reduce the risk of contracting Zika. There is currently no vaccine for the virus. People who have been to a tropical area or another area where Zika is common should get tested after they arrive home. Sexual contact should be postponed and safe sex should be practiced. This means using condoms for at least 6 months after either partner has been to an area where Zika is present. Zika can be transmitted from mother to fetus and cause birth defects such as microcephaly. Zika may be present with little to mild symptoms, so if you are pregnant and have traveled to an area where Zika is present, you may want to see a doctor because symptoms are not always obvious. Current research links Guillain-Barré syndrome, or GBS, an uncommon sickness of the nervous system, to Zika, but very few people develop this syndrome. While this condition is possible, it is unlikely. It is more typical that infected individuals exhibit only mild symptoms or none at all. Symptoms include fever, rash, joint pain, and headaches. These symptoms last for several days to a week. There is currently no data that supports the notion that Zika will have future ramifications. It is believed that once someone has contracted Zika, they are immune to future infections. There are ways to protect yourself and family from Zika. We recommend that susceptible individuals wear long sleeves and pants, use insect repellent, and stay in places with air conditioning and windows and door screens to keep mosquitoes out of the home. The most important thing to remember is to stop the spread of the virus by getting tested if you have reason to believe you have Zika, practice safe sex, wear protective clothing, use bug repellent, and talking to a doctor if you plan on getting pregnant. If you have any questions, please get in contact with your local health center or call the CDC. The CDC knows the importance of protecting and informing Americans about the harmful effects of the Zika virus. This crisis is affecting countries around the world, but we must protect the home front before we can help other nations. We are working closely with CDC agents in Puerto Rico to stop the spread of the Zika virus throughout the United States. The virus is mainly found in Pacific Island areas, which are popular for Americans to travel.
As the CDC, we will not be restricting travel to any of the affected areas, but we highly recommend not traveling to any of the areas that may have the Zika virus. If you will be traveling to an area with this virus, we recommend that you speak with your healthcare provider to identify how the Zika virus can come in contact with you. From January 1st, 2015 to April 12th, 2017, the United States had 5,234 cases of Zika. 4,935 of these cases were from traveling to an area with the Zika virus that was transmitted by a mosquito. 223 of these cases were from mosquito-borne transmissions in Florida and in Texas. 75 of these cases were sexually transmitted from partners with the virus. Zika has the greatest effect on women who are pregnant or may become pregnant. Zika has been found to cause birth defects in babies born from mothers who have come in contact with this virus. Zika is dangerous for anyone who can come in contact with this virus, due to the likelihood for it to spread in many ways. The CDC is urgent in spreading the need for mothers and expecting mothers to not travel to affected areas of the globe. We have partners working all over these affected areas of the CDC, but the best way to stop the spread of this virus is by limiting travel to these areas. Limiting travel will allow the virus to limit itself from its spread throughout the United States. We have found cases in most coastal areas and from civilians who are traveling to areas with Zika have been found throughout the United States. While, as the CDC, we cannot officially stop travel to the world, but it is recommended by us and the U.S. government that we do our best to protect our people by limiting the travel. While this is a warning to the American people, please know the harmful effects of Zika and what it can do to yourself, a newborn, or any of your sexual partners.
Because of its unknown nature, it is easy to feel anxious or panicked when the topic of Zika comes up in the news, in conversation, and social media. It is most likely something you haven't heard a lot about or been exposed to throughout your life. Because of this, we are more susceptible to believing the misconceptions of Zika. We accept information from sources that are not necessarily credible. You must take a step back and recognize that not everything you read on the internet or hear on the news is true. As the Centers for Disease Control and Prevention, it is our job to share with you what is true about Zika and what is not true about Zika. This virus is not new to us. Many people believe that because they have not heard of Zika before, that it must be new. This virus was first discovered in 1947 in Uganda. In 1952, the first reported human case of Zika was discovered. It has been studied for a long time, and before 2015, we had mostly seen cases of Zika in Africa, Southeast Asia, and the Pacific Islands. More recently, we have seen cases in places like Mexico, Latin America, and northern South America. As far as the prevalence of Zika in the United States goes, there have been 346 cases reported that were associated with travel. There have been no reported cases of active transmission in the U.S. Another misconception is how Zika is contracted and how it spreads. As stated earlier, you can be infected by Zika through a mosquito bite, but that is not the only way. You can contract Zika through sexual intercourse, as Zika can be spread from a man to his sexual partners. A woman may also pass the Zika virus to her fetus during pregnancy, but no cases of children contracting Zika through breastfeeding have been reported. However, women should be aware that there is a chance of delivering a child with birth defects. This is not a guarantee, but you should be prepared for the chance of it happening. If you have concerns about your pregnancy, you should consult your doctor. You should also be aware that with Zika, you may not experience devastating symptoms. You would imagine that with a virus like Zika, you would know exactly when something is wrong. That, however, is not true. Symptoms can be mild and short-lived and can also be misleading. You may experience things like a fever, a rash, or conjunctivitis. Depending on the person, you may not even feel sick enough to make a trip to the hospital. As far as who is more susceptible to contracting Zika, Zika does not favor one gender, race, or age group. Everyone who travels to areas where the Zika virus is present should take the proper precautions. We will continue to update the public periodically on the status of Zika in the United States. We will not leave Americans in the dark or allow inaccurate information to spread across social media or news outlets. We will be updating our website continuously with the most up-to-date and accurate information. If you ever feel unsure about something you hear or have concerns, visit our website or contact us by phone. We will be available 24/7 to hear your concerns and clear up any and all misconceptions.
Seeing how Zika has no vaccine or known treatment, transition to normalcy will occur without complete eradication of the disease. Some key goals for the transition towards the end of the crisis are education of the populace about widespread prevention tactics and arming hospitals and health providers with the accurate tools to deal with the disease. In addition, we wish for the general fear of the virus's spread to decrease. On the subject of education, we expect people to use mosquito repellent whenever necessary on trips. Additionally, pregnant women are highly recommended not to travel to infected countries. Another basic tip would be to practice abstinence or use protection when having sex in infected countries. For hospitals, we hope to arm the maternity wards with the tools to provide for the safe births of children infected with Zika. In our role in disease prevention, we hope to increase the availability of testing of the virus throughout the nation. In working with the departments of health in other nations, we expect these basic policies to spread. We hope that once the public sees these improvements, we can reduce the general fear. In order to cement this transition, the public must realize the essential nature of these changes and comply with them in order to help society as a whole. As far as the political ramifications go, we hope that Congress will allocate more funds to us towards discovering a long-term cure for the disease. Not only will this help reduce the number of children being born with birth defects as a result of the virus, but we will also be able to reduce the occurrence in the public. This will help the public health and approval of those politicians in public. Action always gains approval, especially on the issue of disease. As an organization, we understood the impact of spreading information to the public about new viruses. Through this crisis, we hope to impart upon individuals the importance of prevention at the personal level. Seeing that this disease is more common in tourist destinations, travel advisories should be publicized more quickly. Travel during pregnancy is already an issue, but viruses should be used as deterrents in order to protect infant health. In order to prevent such a crisis from occurring in the future, we hope that communities as a whole will take actions such as these seriously in the future.
The proper problem-solving approach involves Cotter's 8-step plan for crisis management situations such as the Zika outbreak. People will tend to be resistant to change even if benefits of such change are evident, so it's crucial to approach change strategically, the change in this situation being travel caution, protected sexual relations, insect repellent, etc. People are resistant to change as individuals due to rigid habits, security, economic factors, fear of the unknown, and selective information processing. Organizations are resistant to change because of structural inertia, limited focus of change, group inertia, threat to expertise, and the threat to established power relations and resources. In this situation, the organizations are the state governmental structures impacted by the epidemic and the individuals within the state's personal precautions. Cotter's 8-step plan outlines tools for strategic reaction in crises. The first being to create urgency, by which we accomplish in communicating the rapid spread of this disease from other countries and within the U.S. through mosquitoes, sexual contact, and birth. The second step is to form a coalition by using the CDC partners and connections within state government to form a top-down approach to awareness. Thirdly, we outline best practices for prevention using data from other resources and research to craft a realistic plan for the nation. Next, we communicated the vision by creating infographics and prevention knowledge to not only prevent the spread of Zika, but to properly treat those inflicted previously through proven tactics. We next empowered others by reaching out to government branches and other NGOs to gain insight to how we can best serve them, providing resources or funding. We then rewarded the wins by providing testimony of successful interventions as well as recovered patients with the hope to inspire the public to action. We consolidated improvements by continuing to trap the epidemic and prove the prevention methods successful. This is how we used Cotter's 8-step plan for the crisis management of the Zika outbreak. Thank you.